What is glaucoma and why is it important?
Glaucoma is a leading cause of blindness worldwide. This is a disease of the eye where the optic nerve which connects the eye with the brain is getting damaged.
You've told me that blindness from glaucoma is irreversible but preventable if people at risk come for checkup. And I understand everyone over the age of 40 is at risk. Who else is at risk?
There are certain group of people who are at more risk, but if we say everybody at risk, so the people with high intraocular pressure, the relatives of the patient who diagnosed with glaucoma are another group of people. When we say relative, it's the first degree of relative, mother, father and siblings. The other group who are using high minus power glasses, those are at risk. The people with hypertension and diabetes, the person with any other eye inflammation like uveitis, the person using a steroid, those are at great risk. The aged people who are at the older age, those are at more risk.
How do you diagnose glaucoma?
Yeah, glaucoma is a disease, as we mentioned. It has no signs and symptoms for most of the cases. But when the disease develops, it damages the optic nerve. Then we check the intraocular pressure. We have different devices in our clinic, and this is the handy one and very convenient for measuring intraocular pressure. So this is a little device which measures intraocular pressure of the eye. We have visual field machine in the clinic where we can examine the peripheral vision. So patient can see direct, but right, left or up and down, patient may notice the constriction of the field of the vision. So that early sign we can pick. We have OCT machine which can give us the earliest sign of the glaucoma. So we do all those tests in the patient, then we diagnose it.
What is the treatment available for glaucoma?
Treatment, as we mentioned, early diagnosis and early treatment can prevent blindness from glaucoma. That's why when we make a diagnosis, that is surprising news for the patient. It's like breaking news. And then we need to counsel the patient first. We describe about the disease as we are discussing here. So for each patient diagnosis of glaucoma, we counsel them and we explain them the treatment. We have different treatment options. So eye drop, laser and surgery. These are the three options currently which can be offered to the patient, and then we can stop the disease at the level and further progression.
So, can I ask, what is the key message about glaucoma that you want us to remember?
The key message for glaucoma, we want to make the public aware about the disease, that glaucoma is one of the leading cause of blindness and everybody at risk for the disease. There is no cure for glaucoma yet, so you need to come many times to your doctors and see how the disease is progression. Mostly we try to reduce the intraocular pressure at the safe level when the optic nerve is not at damage. So we try to bring the intraocular pressure down for the eye and come to the clinic, come to the hospital where your eye should be examined. So don't think that you are not at risk. So only think the glaucoma can be diagnosed after the examination. So you visit the clinic nearby your home and you get diagnosed for glaucoma, start treatment, and then we can prevent the blindness from glaucoma. At RIIO, we have all the latest equipments and we have the qualified ophthalmologists who can treat glaucoma or can counsel the patient.